So RFK Jr., the head of the Health and Human Services Department of the U.S. government, officially just cut $500 million worth of federal funding for mRNA vaccine development. I don't know if this was all of the allotted mRNA vaccine development research money that was allotted. I don't know if maybe there's some other amount that they have allowed that they've said is okay, but my understanding is that this is practically all, if not literally all, of the funding that the U.S. government has been giving or is planning to give towards mRNA vaccine research, which is terrifying because my understanding is that just a quick brief thing, my understanding is that the mRNA vaccine, that the speed at which we were able to get it through and the medical miracle that is the mRNA technology and our ability to create a COVID vaccine so quickly saved somewhere in the ballpark of 14 to 15 million people's lives across the globe. Health and Human Services Secretary Robert F. Kennedy Jr.'s decision to terminate $500 million in federal funding for mRNA vaccine development threatens to unravel one of medicine's greatest recent achievements. His claim that these vaccines fail to protect effectively against upper respiratory infections like COVID and flu represents a fundamental misunderstanding of vaccinology that could cost lives in future pandemics. Yeah, it's a big shocker that Robert F. Kennedy Jr. isn't exactly a vaccine expert. Who would have guessed, huh? As an infectious disease physician who cared for dozens of critically ill COVID patients in December 2020, I witnessed a remarkable shift in the months that followed. As mRNA vaccines became available in early 2021, severe cases among vaccinated individuals became extremely rare. Deaths were almost exclusively among those who declined vaccination, which was tragic given how preventable these outcomes had become. No vaccine for respiratory viruses had ever provided complete, lasting protection against all infections. Not the flu vaccine, not RSV vaccines. That never should have been the expectation. Some vaccines, like those for measles or polio, can effectively prevent infection and transmission, but these target fundamentally different viruses that don't constantly mutate and reinfect the respiratory tract. The purpose of respiratory virus vaccines is to prevent severe disease, hospitalization, and death. By that measure, mRNA vaccines have been revolutionary. To this point it makes, but these target fundamentally different viruses. My understanding, an explanation I heard from a doctor around the time of COVID for why the idea of a completely 100% effective COVID vaccine is unrealistic is because of the extremely short incubation time of the disease, and that necessarily because of the way virology works, that it would be almost impossible to create a vaccine that fully 100% cures and prevents all cases because it has such a short incubation period compared to things like polio or measles or something.
These viruses like respiratory syncytial virus, parainfluenza virus, influenza virus, rotavirus, those are all short incubation period mucosal infections. COVID, another short incubation period mucosal infection. And I think if there's one of the worst things we did early on in this COVID pandemic when the vaccine came out in December of 2020 was not explain that. This is a short incubation period disease, which is to say that you are not going to be protected against mild disease for long. Even if you're naturally infected or vaccinated or both, 6 months later, you're going to be, because antibodies in your circulation will decline, and antibodies are critical in protection against mild to moderate disease, you could get this disease again. And we should have explained that. But we didn't. And I think we didn't because we were desperate to get people vaccinated. In 2021, you were 12 times more likely to be hospitalized if you weren't vaccinated, 12 times more likely to die. And we wanted people to get vaccinated, so I think we overpromised because people would get the vaccine, and it was mandated, which made people even angrier. And then they would get a mild or moderate infection, which wasn't easy, right? Fever, headache, joint pain, sure, coughing. And they were saying, they lied to me. Here, they told me to get this vaccine and I got sick, but you didn't get hospitalized. And that's the goal. Keep you out of the hospital. Keep you out of the ICU.
The data confirms what I witnessed firsthand. According to research by the Centers for Disease Control and Prevention, unvaccinated individuals had 53 times the risk of death compared to those who had been fully vaccinated during the Delta wave in 2021. A New England Journal of Medicine study analyzing over 6 million COVID cases found that protection against death remained above 90% and remarkably durable, even as protection against infection declined. Yeah, so and that makes sense. That can partly be attributed to the vaccine, but that can partly be attributed to the way that viruses like COVID necessarily will mutate, right? They are going to mutate in such a way that they become more infectious but less deadly, right? That way the virus can spread as much as possible. And necessarily the way that virology works, the virus will mutate and select for that sort of thing, right? If the virus continues to get more deadly and it more often kills its host, well, then it's going to less often be spread to other people, and therefore those strains of COVID are more likely, those mutations and strains of COVID are more likely to die off. But the ones that are especially infectious, the ones that spread much more easily than other forms of COVID from person to person, but don't kill the host in the process, are the ones that are going to be selected for the most, the ones that are going to survive, and the mutations that are going to eventually like ride out the longest, because that's just the way virology works. So this, in partly this 90%, so it's a combination, right? The vaccine plays some part in that, but also the way that this sort of disease mutates necessarily plays a part in that. And the way that the disease necessarily will get less deadly but more infectious over time. That's a feature, not a bug. In winter 2020, my hospital's ICU overflowed with COVID patients. Like many colleagues worldwide, I watched patient after patient die despite our best efforts. It was unlike anything any of us had ever seen. By summer 2021, after vaccines rolled out widely, the change was undeniable. Far fewer patients arrived with respiratory failure. Nursing homes saw deaths plummet. As vaccine expert Paul Offit stated in December 2020, all you want to do is keep people out of the hospital and keep them out of the morgue, and I think this vaccine can certainly do that. Even then, before vaccines were widely available, experts understood the real goal. The speed. This is one of the things that frustrates me so much about the people who are like obsessed with Fauci and like how he said the masks would work and then they didn't work or something. It's just like, guys, they're working with the information that they have, right? And like the idea that they may have misspoke or something and come out and claim that masks work, up to 90%, but then the research shows that they only work up to 60%. It's like, oh, my government's been lying to me. Like, I don't know why that perspective has become so prevalent. It makes no sense to me. It is unfortunate that so many people were sold on the idea that the vaccine or that masks or all of these things combined will be 100% effective, and that anything short of that is unacceptable, right? I think that's in part due to the way that this information was presented to people, but I think it's also in part due to people's lack of curiosity and lack of interest to actually, do the research and look up these details and see if these things synthesize properly together and whatnot. So when they see, Fauci come out and say, mask up, it's going to work, and then they see some other report saying, oh, it might not be as effective as we thought it would be, then they think that their conclusion they come to is government's lying to me and they must want me to get Bill Gates microchips in me or something. Like, it's just, I don't know. It's dumb. The speed of mRNA vaccine development was unprecedented. We went from discovering a new virus to having an authorized vaccine in under a year, breaking the previous record of 4 years. Unlike traditional vaccines that require growing viruses in labs, mRNA vaccines can be designed in days once scientists have the genetic sequence. The impact has been profound. Studies estimate COVID vaccinations saved millions of lives worldwide, with estimates ranging from 2.5 million to 14.4 million. In the United States alone, the Commonwealth Fund found the vaccination program prevented 3.2 million deaths. I would say potentially prevented 3.2 million deaths. Secretary Kennedy's critique that mRNA vaccines fail to protect effectively against upper respiratory infections sets an impossible standard that no respiratory vaccine has ever met. I understand why this distinction can be confusing. Public health messaging hasn't always been clear, and the unfortunate term breakthrough infection made it sound like vaccines had failed when someone got COVID after vaccination. This language was deeply problematic. Getting COVID after vaccination isn't a sign of vaccine failure. The real measure of effectiveness is staying out of the hospital, avoiding serious complications, and surviving what could have been fatal. The scientists who developed mRNA vaccine technology won the 2023 Nobel Prize in Medicine for enabling the development of effective mRNA vaccines against COVID-19 during one of the greatest threats to human health in modern times. Now we're abandoning these proven platforms because it doesn't achieve something no respiratory vaccine has ever achieved. See, this article keeps talking within terms, though, like RFK, the things he says are in good faith, and that this is all just because like this is something we should be extremely proud of, just like Social Security, just like so many other things that our government, just like USAID, just like so many other things that this administration seems to be attacking. We should not be cutting them. We should be extremely proud of the part that every American taxpayer paid in the development of this breakthrough, this pinnacle, this peak of human medicine that is the mRNA vaccine technology. It goes without saying, but this is just sort of the exact opposite thing we should be doing with regards to mRNA vaccine technology, right? The effectiveness and speed at which we were able to create and implement the COVID mRNA vaccine was an overwhelming success and should be seen as a model moving forward, and that we should build off of we should build off of what we learned from all of that, not smash it all because of Bill Gates microchip conspiracy theories and adrenochrome and they got heavy metals in there and they're gonna give you autism and they're turning the frogs gay. That's seriously where all of this is coming from. It's coming from conspiracy theories based in absolutely nothing. It's the idea that these vaccines are not actually there to try and help people and prevent infectious disease or whatever, but to control people in some weird way, some weird convoluted way. The HHS decision affects 22 projects worth nearly $500 million, dismantling infrastructure critical for future pandemic response. Secretary Kennedy promises to invest in safer, broader vaccine platforms and mentions whole virus vaccines, but mRNA vaccines have been administered billions of times globally with an excellent safety profile. More concerning, traditional vaccine approaches are far slower to develop. The beauty of mRNA vaccines is that they can be updated within months when viruses mutate or new pathogens emerge. This decision reinforces the false narrative that vaccines failed unless they completely prevent infection. It sends a troubling message to scientists. Why invest in novel platforms if political ideology can defund them despite their success? When the next viral threat emerges, and it will, we may not have the rapid, flexible response that mRNA technology offers. This means slower vaccine development and more lives lost. Vaccines aren't some niche drug. We're talking about medicines that apply to literally every human being on the planet. We should have learned from the COVID pandemic that everyone is potentially susceptible to pandemic threats. The scientific consensus is clear. mRNA vaccines saved millions of lives and could save millions more in future emergencies. It's been less than 5 years since SARS-CoV-2 killed millions worldwide and overwhelmed health systems globally. To abandon the very technology that got us through the crisis is not just short-sighted, it's reckless. And supremely stupid and based in absolutely no real information or logic, but wholly in conspiracy theories like Bill Gates microchips in the vaccines and heavy metals and adrenochrome and they're making the frogs gay and blah, blah, blah.